So liposuction, is it still the most popular cosmetic procedure?
Definitely, Randy. Still is the #1 cosmetic procedure that plastic surgeons do. And we do liposuction everywhere, from neck to the chest area, to the bra strap area, the arms, the tummy, hips, inner thighs, outer thighs, all common areas to have liposuction done. And again, liposuction done well can make a dramatic change in someone's appearance. Totally.
Okay. Let's start from the top. Okay, so neck.
Yeah.
A lot of people doing that?
Yeah, neck is actually a really great liposuction area, and I tell you, it actually helps prevent some of the aging, I believe, in the neck. So typically, a lot of people get this little bulge here. I've had a woman, just big, thick bulge in her neck, and we liposuctioned her down, and she literally looked like she lost 30 or 40 pounds, because that's what you see. Everything else is covered in clothing most of the time, but this you see all the time. Totally changes the appearance of her face. It gave her that really nice, tight, 90-degree angle. And that liposuction in that area creates a little bit of under the skin kind of like a support network of little tight scarring underneath the skin that you can't see, but it kind of supports the tissue.
Holds it up, is that right?
And so I think over years, people who have liposuction here generally sag a lot less on their neck than people who haven't. And so it's less likely to come back to a facelift.
What about arms?
Yeah, arms, it's a huge, huge area. Women sometimes get these huge, thick arms, and just can't get rid of them. They work out, they try to get rid of it.
Just genetically they have?
Just genetically they got it there. And so basically we just put tiny little puncture holes, very minimal. You don't see them at all, scarless really. And we just go in and suction out all that little fat in that area and do it very smoothly so that it keeps it even. There's no irregularities. And I've had a woman who basically, she always wore either blazers or sweaters that kind of cover and hide those arms. After we did the surgery, she was wearing sleeveless tops, and she was basically out with sleeveless dresses. It's totally changed a lot of her life. Again, and I've had other women who, not only arms, but in the bra strap area, they've never gone to the gym.
Like the back fat?
Yeah, because, they're worried everyone's looking at their back fat that's hanging above the bra. You liposuction that down, and that woman actually lost 30 pounds after that, not because of liposuction, but because now she's back at the gym.
So the fat obviously doesn't come back in those areas?
No, the fat, when you suction that fat out, it doesn't come back in those areas. Your fat cells can get bigger, but they don't duplicate in that area.
So bra fat, very interesting.
Bra fat's another area. For women, typically, most common for women is tummy, outer thigh, hips, inner thigh. For women, that's the most common, and those areas are classic areas for women to collect fat, and sometimes a bit on the knee as well. And so we suction all those areas, and a lot of times we do them at once, smooth out the whole body. For men, it typically goes in the sort of abdomen and around the back of the hips, that sort of, instead of Michigan tire kind of thing right around there.
Okay.
And so that's a common area where we shape that out, and we can actually, if we spend the time, you can actually liposuction and liposculpt or shape almost ab-line shadows with the liposuction, or muscle shadows. You can do all that, and it's basically high definition liposculpture is what it's called, and that's also things that we do.